Madam Jyoti Sapru. She is a registered counselor of different renowned government and non-government organizations such as Counselors Council of India, National Career Service, and others, many others. So she also worked with many good schools such as MHS, LSA, Ashoka Hall, Sri Sri Academy, St. Thomas. I hope you all will be benefited by her valuable advice. Thank you. So she will continue the workshop now. So over to Jyoti.
Thank you so much, ma'am, for the lovely introduction. It is absolutely my pleasure. And I feel it's a great opportunity for me, especially during COVID times when children are stuck at home, students are home. This is the best way we can reach out and we can stay connected on different issues. And since I am a mental health professional, I have done various webinars on mental health issues. And I hope the children will enjoy. I have prepared a PowerPoint presentation, which I will share on my screen. And they will definitely benefit from it. My only request is that we can, mute everybody so that there is nobody talking. Otherwise, I just lose my flow of thoughts. And also, if there is any question, they can just write it in the chat box and we will take it up in the end when we have the interaction. So is that okay, ma'am?
Yes, absolutely. Absolutely.
Okay. Okay. So I think without wasting time, let us start. I'll just put up screen share. So is this slide visible to everybody?
No, ma'am. No.
You're not able to see the slide? No, okay, okay.
No,
let me try. Okay, just hold on, please. The host can kindly allow me to do screen sharing, please.
The permission has already been given. So.
Ma'am, it says that the host has disabled the participant screen sharing. I'm trying again. Yes. Yes, now I think it will come.
Okay.
Okay, everyone, can you all see the slide now?
Yes. Yes, ma'am.
Okay, yes. Great. Yes. So this is about growing up kids like you all who may have mental health issues. Now, one thing I want to make very clear, because I don't know if you've heard about any mental health issues or experienced anybody in your surrounding, but it is very, very normal to have, like you have physical health issues, you have cough, you have cold, you have fever. Similarly, it is very normal to have a mental health issue. And if we can identify the issue, then we should come forward and we should express it and talk to our teachers, our guides, our parents, our families, and try to solve the problem. Okay? So now I want to just explain that what exactly is the meaning of mental health quickly. So the World Health Organization has defined mental health as a state of well-being, that you feel good, and individuals, they recognize their abilities. You are able to recognize your abilities, whether you're good in sports or you're good in academics or you're good in entertainment, to recognize your abilities and you're able to cope with the normal stresses of life. This means that you will have stress, you will have problems. It is nothing to be scared of. So every time you have a stress and you are able to cope with it, you are able to perform your normal duties, that means that your mental health is good, and also that you make some kind of contribution to the community. Like you all are guides, you're trying to be strong and positive and bring a good change in the society. So all the best to all of you. Now, according to the World Health Organization, they say that many adolescents die every day because of certain mental health issues, so we have to be sure that these issues are solved by us before they become very deadly or fatal. Am I clear to everybody?
Yes, ma'am.
Okay, come on. Now I will
Yes, ma'am.
tell you what are the different types of problems or disorders that you can look out for. Now, mental health problems and disorders in adolescent, right from the age of the age of 10 years, you can have certain issues. And the most common one is depression. I will explain you later what it is, but this is nothing to be scared of. Everybody goes through it. So it's not something that is very scary and it's going to harm you in any way. It's absolutely fine. You just know how you can take small steps to get over it in a positive way. So there is depression, then there is anxiety, there is ADHD disorders, then there is eating disorders, there is conduct disorders, there is substance misuse disorder, and also something called panic disorder, traumatic stress disorder, personality disorder, schizophrenia, autistic spectrum disorders. These are less common, but the most common being depression and anxiety. These are the two most common disorders. Okay, so now how do we differentiate normal behavior versus mental problem? Do you understand what we are discussing? Now we are discussing what is normal behavior and what is somebody having some mental problem. What is the difference? So the variations of mood and temporary deviant behaviors are part of normal adolescent process. Now, you have variations in your mood. Someday you fight with mama and you're not talking to mama, or someday you get angry with papa's come home late, so you are sulking. So you have some variation in your moods. Sometimes you're happy, sometimes you're sad, sometimes you're angry, sometimes you're irritated. So these are different kind of variations in the mood, but it has to be temporary. Temporary means it should not go on for many, many, many days. It happened, and then your mama said, okay, beta, I'm sorry. And then you say, it's okay, mama, and everything becomes fine again. So then the mood is again become normal. So variation of mood and temporary deviant behaviors are part of the normal adolescent process. It is normal for young people to feel depressed. Please understand this. It is normal for young people to feel depressed from time to time, and for this mood to last for several days. Similarly, many young people will experiment with drugs or delinquent behavior as part of normal exploration of their own identity. And such normal behaviors can be distinguished from more serious problems by the duration, persistence, and impact of these symptoms. Now, whatever we are discussing, the change in your mood, and you're trying to do different kind of experiments to find out what kind of a personality you have. So when you are experimenting, this is what is going to give all of you an individual identity. So how do we understand that somebody will need help? How do we understand that somebody is having a mental problem and needs help? So what do we see? What are the signs or what are the symptoms? Now, signs of overt mood depression, low mood, tearfulness, lack of interest in usual activities. These are the symptoms we have to watch out for. Somatic complaints such as headache, stomachache, backache, and sleep problems. Sometimes there are self-harming behaviors. Sometimes there's a lot of aggression, isolation, loneliness, deviant behaviors such as theft and robbery, change in school performance or behavior, use of psychoactive substances, including over-the-counter medication, weight loss or failure to gain weight with growth. These are some of the signs which will tell us that somebody is going through some mental health issue. And I told you which is the most common one. The most common one is depression. So how do we find out that somebody is depressed or going through any form of depression? When that person is persistent, sad or irritable mood. There is loss of interest in activities once they enjoyed. Substantial change in appetite or body weight. Oversleeping or difficulty in sleeping. Psychomotor agitation or retardation, loss of energy, feeling of worthlessness or inappropriate guilt, difficulty in concentrating, recurrent thoughts of death or suicide. Now, these are some of the signs, symptoms, which will tell us that the person is going through some kind of depression. So we all understand that from child, you're growing up and slowly you're going to become an independent adult. So this is a stage of transition. There is a lot of changes happening in the mind, in the thinking, in the body. So all these changes are known as transitions. So adolescence sees the transition from childhood depressive illnesses to more adult forms. Now, what they are trying to say here is that if we do not identify, if we cannot understand that there is some problem in the child, then it will grow up to be more severe in the adult. And then they will have more problems. So I hope that you all understand that whenever you can identify a problem at a young age, you must speak to a counselor. You have school counselors, you have your seniors, you have teachers, you have friends, you have family. So speak up. And however, masked presentation, for example, behavioral problems, substance misuse, school phobia or failure at school, fatigue and other somatic symptoms remain common in early adolescence, particularly in boys, not girls. Okay, so the potential risk factors for adolescent depression. Why do some people get depression and why do some people don't get depression? Why? What is the cause? What is the reason? Let us try to understand why. So there are potential risk factors like family history. If somebody who has a family history of depression, children can also be, getting the symptoms at an early stage. Then there is some recent bereavement or family conflict. That means there is some loss of some loved one, there is some grief, or there is some family dispute or conflict which may cause depression. Then breakup of a romantic relationship also leads to depression. Having a chronic medical condition can also lead to depression. Physical abuse can also lead to depression. Trauma and severe stress. If somebody has had some shock, some trauma, then they can also have a symptom of depression. Then there is anxiety. Anxiety means you worry too much. You think too much about your exams, about your studies, about your job, about your future. So all these can also lead to some kind of behavioral problems. Then there is learning difficulties. Children who have difficulties in learning may also experience some kind of depression, and substance misuse is another reason for depression in adolescents. Okay. Can you please?
Please mute yourself. I think somebody has unmuted.
Yes, thank you so much. Thank you. So to evaluate the risk of depression properly, young people must be interviewed confidentially, and additional information gathered from parents as well as other sources such as teachers, social workers, or youth workers, as well as eliciting symptoms and risk factor for depression. It is essential to assess the potential suicide risk in depressed young people. They must be asked about past and present ideas and self-harming behavior, any past attempt, or whether the plan to harm themselves. You see what they're trying to say. It's very important that we keep a target on these children who might be suffering from depression, and keep on interviewing the child along with the other sources of information. It's like a case study, so that we know what the child has done in the past, how it is now, and how it will go and be in the future. So this is our role as mental health professionals. We are trained to do this, and we are able to help the children from a small age to get over any kind of symptom that they may be having. So I will not go into detail of different kind of disorders because they are not so important. But I will now talk about how we can help these children, how we can, try to do some kind of counseling. School counselors, they can help students build bright futures. Now, what are the benefits? Why do you feel that, the teenager or children can be told about positivity? They can be told about how to become stronger mentally and find new horizons in their life. So we turn to the benefits of counseling. Now, what do you understand by counseling? Counseling is a talking therapy that involves a trained therapist listening to you and helping you find ways to deal with your emotional issues. Sometimes the term counseling is used to refer to talking therapies in general, but counseling is also a type of therapy on its own. So if you cannot talk to mama, you cannot talk to papa, you cannot talk to your miss, you cannot talk to your friends, you can always talk to your counselor. The counselor will not judge you. The counselor will keep your secrets safe, and you can talk to them, open up, and discuss any problem that you might be facing. So what can counseling help with? Counseling can help you cope with a mental health condition, like we just discussed, depression, anxiety, or even a eating disorder. Counseling can help you cope with an upsetting physical health condition. It can also help you with a difficult life event. If there has been some death in the family, or somebody is very sick, any kind of stress that you're facing, counseling is the best way to take a therapy and help yourself. So difficult emotions can also be tackled with counseling, and there are many other issues which we can tackle with counseling. And what can you expect from counseling? When you go for counseling, what do you expect? It's not like a magic pill that you will eat and all your problem will disappear. No, it has a process. So at your appointment, you will be encouraged to talk about your feelings, about your emotions with a trained therapist who will listen and support you without judging you, without criticizing you. The therapist can help you gain a better understanding of your feelings and thought processes and find your own solutions to problems, but they will not usually give advice or tell you what to do. So counseling can take place face-to-face, one-to-one counseling, in a group. If you feel comfortable, in a group of friends can go together for counseling, over a phone. If you don't want to meet physically, over a phone, you can talk to a counselor, or by email. You can write an email to the counselor and the counselor can guide you. Online live chat services, online tools, all these are ways in which you can vent out, you can open up, you can share your heart with the counselor. You maybe offer a single session of counseling or a short course of session over a few weeks or months, or longer course that lasts for several months or years. It can take a number of sessions before you start to see progress, but you should gradually start to feel better with the help and support of your therapist. So this is basically all about counseling and therapy. And how long do kids need therapy? This depends on the goal you and your child therapist have. Whenever you have a goal, you have to reach that point. That will decide how many sessions of therapy you need. And how can the parents help you? You can do things to help your child to get the most from the therapy. Here are some points, especially for parents, I have written. Find a therapist you and your child feel comfortable with. Your child's healthcare team can help you find someone. Take your child to all the appointments. Do not miss your counseling appointments. Change takes time. It takes many therapy visits for your child to learn new skills and keep them up. Meet with your child's therapist. Ask what to do when your child shows problems at home, and ask how to help your child do well. Spend time with your child, play, cook, read, laugh together. Do this every day, even if it's only for a few minutes. Parent with patience and warmth can use kind words even when you need to correct your child, show love, give praise when your child is doing well or trying hard. So I will stop the presentation now and take up questions about anything you want to ask me. You can unmute yourself and one by one you can ask.
Ma'am,
Yes.
ma'am, to reduce mental health issues,
Yes.
if we meditate, will it reduce?
That's a very, very good question. You know, whenever we go, people say do yoga, do meditation, do pranayam, and your stress will go away. But always it is not the cause, because sometimes we don't know what is meditation. We don't know how to do meditation. So until and unless you are completely aware of how to do meditation in a proper way, it will not work. So first you will have to learn meditation, and then of course if you can practice meditation, say half an hour in the morning once you get up and half an hour before going to bed, it will definitely help you. It will give you strength. It's all about your own inner strength that will help you fight any problem you face, whether it's mental, physical, social, financial, any problem. It is your own inner strength, and meditation can definitely help your mind become stronger. It will improve your concentration. It will help you focus on good things in life. Okay?
The mind also will be calm.
Sorry.
The mind will be calm if we do it
Yes.
properly.
That is the key. That is the key to all the problems. Keep your mind calm. You know that movie in which Govinda's movie, I will tell you one example. Govinda is standing in the bus and there is somebody in front of him and somebody behind him, and the bus brakes and the person behind Govinda, he falls on him, and then Govinda falls on somebody else in front of him, and then that person says, hey, तुमने मेरे को धक्का क्यों मारा? तो he says, मैंने मारा तो मारा, मैंने दिया तो दिया, तुमने क्यों लिया? So similarly, there'll be a lot of people around you who will give you dhakka, but you will not take it. You will be so strong that nothing can move you. Okay?
Ma'am,
Ma'am, I wanted to ask you something.
Yes.
Ma'am, what is anxiety?
Anxiety is, it is repeated thoughts of worrying. When we worry too much, we think about something and then we become too anxious. Like today, if I have to give this presentation, and for last 4 days, I'm getting anxiety. I'm having anxious. Oh my God, how will I talk? How will I, face so many people? And because of that, I stop eating, I stop sleeping, I stop going out, I don't go to party, I am just sitting home and I'm worrying. So that increases my anxiety, and then I become weak, and then I become a prey to my negative thinking, and then that negative thinking keeps on increasing. So what is the key here? The key is not to worry too much, not to think too much. I have prepared my presentation. I am confident that all you lovely girls will talk to me and I will talk to you. So there's nothing to worry. So we must always reinforce positive thinking. Then there will be no worry. There will be no anxiety.
ma'am,
Thank you, ma'am, for the information.
Well,
Ma'am, can I ask something, ma'am?
Yes.
Or is somebody else already asking? I'm Miss Preeti Bhatia, ma'am.
Yes.
Miss Sapru, I was just wondering, being anxious, suffering from anxiety, and and getting upset over someone's behavior, something that is not appropriate, whatever is happening around you. But I think, ma'am, it's very common. It's happening with every person, not second person. Every person, I think this happens.
Yes. Yes. Yes.
You think every person needs counseling, or they just like, I can be upset for 2 days, 3 days, but the 4th day I myself automatically will forget and move ahead. But this happens with everyone. It's, I think, very rare that somebody is upset only for a short while and
Yes.
somebody pretends to be fine. I feel that many times people pretend to be fine, but they are not.
Yes.
It's like not forgotten, not forgiven. I'm not showing it on my face. I'm not showing it on my behavior. But
Yes.
I think some people pretend to be fine, but actually they are not fine. That's what I experience. You know?
Yes.
So what do you have to say, ma'am?
Yes, I feel that everybody goes through, like we said, the most common, suppose depression, okay? Everybody goes to depression at some point in their life. Some go in childhood, some go in teenager, some go in adult, some go in old age. And the frequency of these episodes and the intensity, the strength of these episodes may differ. We all are different, our minds are different, our situations are different, our environments are different. So no two cases can be same. So it is never right to give any advice to somebody unless you are a professional, because it is that person's battle and that person is in the situation. We are not in that situation, so we cannot give proper advice. And like you said, that people pretend to be okay, because the new age mantra is, it is okay not to be okay. We have accepted mental health issues, and we understand that we are not okay. We are not going to judge you, and it is okay. You take your time, you fight your battle. We are all here to support you. Whenever you need us, you can reach out for help, and it is okay not to be okay. So that is the thing, that people, they pretend to be okay, but they know that they have to fight it out within themselves. They have to sort it out. And in case you see that somebody is going beyond a limit, then you please reach out for professional help.
Correct. Thank you so much for your explanation, Miss Sapru. Now, this phrase, it is okay not to be okay, I have also learned and in fact heard it from Mr. Amitabh Mohan. I have heard it from him also several times. He's also a psychologist. He has had many counseling sessions in our school, also many workshops he has conducted. So I've heard this phrase. So, you know, it gives a lot of relief, you know, for everyone to hear it's okay not to be okay.
Yes, absolutely. We all go through it. It's normal. It's nothing to be
Yes, yes.
scared of, or nothing taboo that you have to hide. Oh my God, I have depression. People will not love me. No, even Deepika Padukone could come up on TV and say that she went through depression. So don't we love her now? We love her more,
Of course.
because she is so strong that she came out of it, and then she's helping other people come out of it. So similarly, anybody going through any issue understands that issue better than normal people, so-called normal people, and they can help others come out of it. So use your weakness and make it your strength.
There
Sorry
are a
to
few
interrupt,
questions.
but we have only 3 minutes left, and we have a couple of people in the chat and as well as raising their hands.
Yes.
I have a question.
Ma'am,
So ask how to control our emotions. Like if someone says us someone to says us something, so how to control our aggression and emotions that time.
Yes, that's also a very, very intelligent question. I don't know how many of you have seen a shivling. Have you all seen a shivling? The shivling is sitting, and we put milk on top of it, it goes. Then we put honey on top of it, it goes. We put dahi, anything we put, the shivling remains the same, isn't it? It doesn't get affected. So similarly, we have to be strong. Let somebody try to put some negative or say something or try to disturb our mental peace. What the other person is doing is not in our control, but how we are going to respond, how we are going to react. We can give one tight slap or we can just ignore कि ये तो बोल रहा है, इसका आदत है बोलने का, बोलने दो. Do your work, read a book, sing a song. You know, I had a case where the sister is screaming and the other sister, she starts singing a song. She's not bothered, she's not getting affected. So it is up to you whether you will give the remote control of your life in somebody else's hand or you will keep it with yourself. Okay?
Thank you, ma'am.
Welcome.
Ma'am, I have to tell you something.
Yes.
Yes, sir.
Ma'am, I'm Aratrika Mukherjee.
Yes.
Ma'am, I have a doubt. Ma'am, you see, ma'am, in small things, I get overexcited. Like in something that
There
is
is less than a minute left. Can we make it a recurring meeting? Somebody can help us to record this meeting, or otherwise it's just going to finish now.
Oishika, can you
Ma'am.
record it?
Ma'am, I'm Aratrika Mukherjee. Ma'am, you see, I'm over emotional. Like when something very
Oishika,
mild,
can you
sad,
record it?
something sad happens, I start crying as if the world's going to end like that. So I get overexcited in things like when something is supposed to cause me very less anger, I get very angry, and something very less happy, I get a bit happy, more happy like that. Than I
Yeah,
should
but
be.
then that's what childhood is all about. Enjoy the childhood emotion. You can't do that when you're an adult.